Hello, my name is Kirsten Easley, and this presentation will explore infectious mononucleosis, also known as the kissing disease. Mononucleosis, or mono, is caused by the Epstein-Barr virus, which is a part of the herpes virus family. It is defined by the presence of abnormally high mononuclear leukocytes in the blood. EBV does remain dormant in the body for life after infection, but is not always reactivated to cause mono. Mono is spread through both direct and indirect, but the most common transmission is direct through saliva exchange, such as kissing, hence the name the kissing disease. Mono can also be transmitted through droplets and the sharing of drinks and utensils. The incidence varies by region, with higher rates in the Americas and Europe compared to Asia and Africa. By adulthood, over 95% of people have antibodies to EBV, resulting in a high prevalence of this disease. Mortality is rare at less than 0.1%, but complications such as splenic rupture and chronic conditions can occur. The incubation time for mono ranges from 3 to 6 weeks and can cause symptoms that interfere with the quality of life. The three major symptoms and signs of mono are a sore throat, swollen lymph nodes, and fatigue. Other signs include fever, headache, nausea, and an enlarged spleen. There is no treatment for mono, so medication is only given to treat the symptoms such as sore throat or fever, but it can be managed with rest, fluids, and abstaining from contact sports until cleared by a doctor. Young adults are more at risk, particularly between the ages of 15 to college age, considering the close contact of dorm living. Additionally, military personnel and athletes are at risk due to the close quarters and physical contact that may cause splenic rupture. Children are also at risk as they tend to be asymptomatic. So mono peaks around the ages of 15 to 19 and often more times in females and in those who are white or non-Hispanic. And unlike some diseases, mono does not have a strong hereditary or genetic association, in addition to marriage status not being found as a correlation. Mental health can be affected indirectly since prolonged fatigue can contribute to depression or anxiety. Social determinants like close contact, kissing, and sharing drinks can increase exposure. Environmental determinants include living in dormitories, military barracks, and in some areas, poor sanitation. Both of these factors combine to elevate the risk in young adult populations. Disparities appear in low-income countries or environments, causing early infections, which can then lead to appearing asymptomatic. In high-income areas, infections are often delayed, which leads to more symptomatic cases and long-term conditions. Limited healthcare access may worsen recovery, and prolonged absence from work or school can impact the quality of life. So there are currently no vaccines available, but there are rapid tests such as the monospot, which is a blood test that is taken as a finger stick, and then the levels of antibodies are tested to confirm the infection. Research has continued to link EBV to autoimmune disorders such as multiple sclerosis, lupus, rheumatoid arthritis, and some cancers. Long-term effects are also being researched and connected to mono, such as chronic fatigue and depression. These hypotheses point to the virus's role in health beyond just mono itself. So current gaps include the lack of a vaccine. Despite decades of research, there are limited trials. Additionally, the mechanisms remain unclear on how EBV contributes to autoimmune disorders. More work needs to be done to clarify why individuals may experience long-term effects while others fully recover. Some recommendations include expanding health education on transmission prevention, especially in colleges, as at that age the risk may seem low, while social determinants actually increase it. Also, as mentioned previously, vaccine research needs to be prioritized as there is a serious link to long-term conditions. Future research should focus on the long-term effects of EBV, especially chronic fatigue. Longitudinal studies following patients after infection are needed to identify who is at risk for prolonged illness or reinfections. Research must also address the social and psychological impacts of fatigue, including education and work disruption. With no vaccine or specific treatment recommended, prevention focuses on education and behavioral change. The CDC recommends avoiding sharing personal items and avoiding contact with those infected. These are my references. Thank you.